If you are just joining us now for this coronavirus update, we come to you every weekday. We start about 1 p.m. Eastern, 10 a.m. Pacific. I'm Claudine Wong, and I really appreciate you tuning in as we bring you updates from around the country and around the world as we just try to wrap our minds and our arms around this pandemic that has taken over all of our lives. Let's take you straight to Detroit now as we go to Deena Centofanti, who's talking about really what's happening in Detroit. When we talked before, we've talked about, you know, the Motor City kind of shutting down, but now we want to talk about really kind of how it's restarting in a different way, because if Ford Motor Company can do this and we see all these businesses kind of switching gears, you know, it does make us feel like we're all in this together and pretty innovative in a way that we can figure out how to help.
And we like the switching gears pun, Claudine, here in the Motor City. So, yeah, that is one of the things that we're seeing, right, all over the country, and that's why we appreciate this, these segments that we do, because we get to hear from people all over, and there is a shared anxiety that we all feel, this connection that we feel, because from one end of the country, from your end all the way over here to my end, we are all feeling this very similar emotions, but at the same time we're also seeing people really stepping up to make a difference. And Ford Motor Company is doing just that. Let me give you the current numbers, by the way. Here in Michigan, this gets updated, by the way, at 2 o'clock Eastern, my time, so it'll be updated in about a half hour. But as of right now, we're at about 1,791 cases. We'll call it 1,800 reported cases and 24 deaths. And I got to tell you, Claudine, and this probably is something that you are dealing with as well, now that we're hearing about who the victims are, it's getting harder and it is hitting home. For a while, this was something that we didn't even think about in our country, and then it came to the United States, and then it sort of spread, and we started keeping track, and now people that we're friends with, people in our community, leaders in our community, members of the police department. So, and it really starts to hit home, and you realize the severity of the situation. So that's one of the things, the emotional toll that this takes on all of us. One of the biggest hospital networks here in Metro Detroit says they're reaching near capacity for patients. So hospitals short on staff, short on supplies, much like the rest of the country. So the auto industry has been stalled, but Ford Motor Company is pledging to help speed up production of much needed medical equipment. So this is interesting, using materials from different locations. Ford is teaming up with manufacturers 3M and GE Healthcare, and they're building face shields, respirators, ventilators. Ford is hoping to assemble 100,000 face shields per week, while also leveraging the company's 3D printing capability to build disposable respirators for health workers. So the first 1,000 face shields will be tested at area hospitals this week. So take a listen.
And we're testing the face shields this week in Detroit area hospitals to make sure they work, and then we can ramp up very quickly. We're already doing the N95 masks. We're 3D printing those. With 3M, we're doing the respirators, and the goal there is to dramatically increase what they're already doing. We'd like to do it by a factor of 6x to 10x what they're already doing. And on the ventilators with GE, we're helping them prototype. We're using our engineers and our manufacturing people, and then as soon as we get that right, we're going to go like crazy. There's a national emergency. We're responding to it. We are turning our amazing employees loose to solve these problems, and they're doing it. And I'm so proud of them.
Yeah, so that was Bill Ford Jr., Claudine. General Motors, Tesla also working to make ventilators. Fiat Chrysler working to make and donate more than 1 million face masks also. So this is impressive to see, isn't it? How people are, and there's also a health, you know, they have to be careful to protect their own health while they're doing this to help the health of others.
Right. Well, and you talk about the numbers and what you're seeing, and certainly we know that some of the numbers are going to swell because of testing, but, you know, I have a lot of friends who are on the front lines, healthcare workers. You know, my friend who is a nurse showing me that she was wearing an N95 mask, a surgical mask over that, and then a face shield because she goes to work every day, and she said, I'm afraid a lot. And so it is great to see something that will help. I mean, the WHO told me yesterday, they're like, every country, and your country specifically, is so innovative, and this is what we should be doing. I get the sense from the interview that we just saw too that there is a lot of collaboration between who are normally competitors, who are also kind of joining together and saying, you know, we're going to share all we're sharing all this information, and we're all in it together, and that's got to make, you know, make people feel some pride in what's happening.
Well, and what you have, with these big corporations, I mean, Ford Motor Company, General Motors, sure, they're huge corporations, but they also consist of people who have families, who have, elderly parents, who have brothers and sisters who might be at risk. So when it comes right down to it, everybody wants to make this problem go away as quickly as possible and be part of the solution. I think that makes us all feel better if we feel like we're doing even the tiniest part to help be part of the solution.
So
something else that I found interesting that I wanted to talk to you about. What's that?
Go ahead.
The first NBA player, do you remember, we
Rudy
talked
Gobert,
about
yeah.
this guy quite a bit. He said he had no symptoms. Rudy Gobert from the Utah Jazz. Well, then he said that he had lost his sense of smell. And losing your sense of smell, as it turns out, and taste are symptoms of coronavirus. We haven't talked a lot about that until now, but ear, nose, and throat doctors in England were first to put out a warning about this. And I talked to Dr. Matthew Sims. He's an infectious disease expert from Beaumont Health, and he explained a little bit of this.
It's been reported from all the other countries that have had significant outbreaks. In fact, Germany is reporting that they're seeing it in about 2 out of every 3 patients. It's interesting, the milder coronaviruses, the ones that cause the common cold, have been shown to do this, just not to this extent. So it looks like it really can be a presenting symptom of this disease. And in fact, for the people who have just sort of the very mild cases, this may be the only symptom they have. So it may end up being a good screening tool. If you lose your sense of smell, that's not, unless you're really stuffy and you can't smell because you're just all stuffed up. If you lose your sense of smell, that's a very unique kind of a symptom. That's not something you could be like, oh, I just had one cough. Do I have coronavirus? I feel kind of tired today. Do I have coronavirus? Losing your sense of smell is pretty specific.
Yeah, so that's something to think about. Now, right now, we should tell you that the CDC is not warning about the loss of smell and taste as far as that being a symptom or a red flag, but it could be something to keep an eye on, especially in younger patients who tend to have milder symptoms. So remember, when you, so now you walk around trying to smell stuff to make sure that you have a sense of smell. So I feel like we are being inundated with so much information to do self-analysis. But it's good to keep it all, information is power, right?
Right. And he's right. It does make sense because, your head hurts. Well, we're exhausted. We're stressed out. We have anxiety. Maybe you're not breathing as well. The cough and the fever. The fever was a good one, but maybe everyone will just walk around their houses and trying to smell something, because that is a unique one. And man, it is hard to navigate through this territory. All right, Deena Centofanti, as always, we appreciate the chat. We always like talking to you and all the insight that you have, and we wish you guys health and safety out there in Detroit.
Thank you. You too, Claudine. Talk to you soon.
Talk to you soon. All right. Thanks, Deena.